Welcome and breathe deeply with me. Let yourself relax completely. Today we're going to explore oil cleansing, a method that might sound counterintuitive at first, especially if you have oily skin, but that can transform your cleansing routine. The idea of washing your face with oil might seem strange. We're taught from a young age that oil causes problems, clogs pores, causes breakouts, makes skin greasy. So washing with oil sounds backwards. But there's ancient wisdom and modern science behind this method, and understanding it might change how you think about cleansing forever. Let's start with a fundamental truth. Oil dissolves oil. This is basic chemistry. Oil-based substances on your skin, sebum, sunscreen, makeup, environmental pollutants, dissolve readily in oil. They resist water-based cleansers but surrender to oil. This is why oil cleansing is so extraordinarily effective at removing stubborn buildup. Your skin produces its own oil, sebum, for very good reasons. Sebum protects, moisturizes, and maintains your skin's acid mantle. It's not your enemy. Problems arise not from having oil, but from having the wrong balance of oil, from oil mixing with dead cells and debris, or from trying to strip oil away too aggressively. When you use harsh, stripping cleansers to remove oil, your skin often responds by producing even more oil to compensate. This creates a vicious cycle. Strip the oil, skin produces more, you strip again, skin produces even more. You're fighting against your skin's natural wisdom. Oil cleansing works differently. It gently dissolves excess oil and impurities without stripping your skin's protective barrier. Your skin doesn't need to panic and overproduce oil because it hasn't been stripped bare. Over time, this can actually help normalize oil production. Now let's talk about different approaches to oil cleansing. There are two main methods: pure oil cleansing and emulsifying oil cleanser use. Both are valid, but they work differently and suit different needs. Pure oil cleansing uses single oils or oil blends without any emulsifiers or surfactants. You massage the oil into your skin, let it dissolve impurities, then remove it using a warm, damp cloth. This is the traditional method, simple, natural, and effective. Popular oils for this method include jojoba oil, which is actually a wax ester that closely mimics human sebum, grapeseed oil, lightweight and suitable for oily skin, sweet almond oil, gentle and nourishing, sunflower oil, affordable and effective, and argan oil, rich in beneficial nutrients. The process is simple. Massage a small amount of oil onto dry skin for 1-2 minutes. Let it sit briefly to dissolve everything. Then place a warm, damp washcloth over your face for 30 seconds to steam and soften, and gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. This method is natural, affordable, and allows you to customize your oil choice precisely. However, it requires more time and effort, can occasionally leave some residue if not removed thoroughly, and some people find the cloth removal step inconvenient. Emulsifying oil cleansers are commercial products specifically formulated for facial cleansing. They contain oils plus emulsifiers that allow the oil to mix with water and rinse away cleanly. These are the cleansing oils and balms we discussed in the double cleansing section. With these products, you massage the oil onto dry skin, add water to emulsify, turning the oil milky. Then rinse thoroughly. No cloth needed, no residue, just clean, soft skin. Emulsifying oil cleansers are more convenient. Rinse away completely and typically remove waterproof makeup and sunscreen more easily. However, they're more expensive than pure oils, may contain additional ingredients that some people prefer to avoid, and offer less customization. Both methods work beautifully. Choose based on your preferences, time availability, and skin needs. Let's address oil cleansing for different skin types, because this is where the method's versatility really shines. For oily skin, yes, oil cleansing can work wonderfully for oily skin. It seems illogical, but many people with oily skin find that oil cleansing helps balance their natural oil production better than stripping cleansers ever did. Choose lighter oils like jojoba, grapeseed, or hemp seed oil. These won't feel heavy or potentially clog pores. Or opt for an emulsifying oil cleanser, specifically labeled for oily skin. The key is thorough removal. Make sure you rinse or wipe away all the oil. Some people with oily skin prefer to follow their oil cleanse with a gentle water-based cleanser, double cleansing, to ensure no residue remains. Give your skin time to adjust. In the first week or two, your skin might produce more oil as it figures out what's happening. This is temporary. After 2 to 4 weeks, many people see their oil production normalize to healthier levels. For dry skin, oil cleansing is particularly lovely for dry skin. It cleanses without stripping away precious moisture. You can choose richer oils like olive oil, avocado oil, or argan oil that provide extra nourishment. After oil cleansing, your skin will feel clean but soft and conditioned, never tight or uncomfortable. This is exactly what dry skin needs: gentle cleansing that preserves the skin barrier. You might not even need a second cleanse. Some people with very dry skin find that oil cleansing alone is sufficient in the evening, followed by just a splash of water in the morning. For combination skin, use different oils for different areas, or choose a medium weight oil like jojoba that balances both dry and oily zones. Alternatively, use an emulsifying oil cleanser designed for combination skin. Pay attention to how different areas respond and adjust accordingly. Your T-zone might need more thorough rinsing, while your cheeks might appreciate slightly less aggressive removal. For sensitive skin, oil cleansing can be excellent for sensitive skin because it doesn't involve harsh surfactants or potential irritants. Choose gentle oils like sunflower, sweet almond, or jojoba. If using pure oil cleansing, be very gentle with the cloth removal. Don't scrub or rub harshly. If using an emulsifying cleanser, choose fragrance-free, hypoallergenic formulas. Many people with rosacea or eczema find oil cleansing more comfortable than traditional cleansers because it's so gentle and non-stripping. For acne-prone skin, this is where skepticism runs highest. But oil cleansing can actually help acne-prone skin. The key is choosing non-comedogenic oils and ensuring thorough removal. Jojoba oil is ideal for acne-prone skin. It's non-comedogenic and helps balance sebum production. Grapeseed oil is another good choice. Avoid heavy oils like coconut oil, which can clog pores for some people. Oil cleansing excels at removing sunscreen and makeup thoroughly, which is crucial for preventing clogged pores. It can also help soften and loosen existing clogs, making them easier to extract, though you should never squeeze or pick. Some people with acne find that oil cleansing reduces breakouts because their skin is truly clean without being stripped and irritated. For mature skin, oil cleansing is wonderfully gentle and nourishing for mature skin. It cleanses without disturbing the delicate skin barrier that tends to be more fragile with age. Choose nourishing oils rich in antioxidants and beneficial fatty acids. Rosehip seed oil, argan oil, evening primrose oil, or marula oil. These provide gentle cleansing plus anti-aging benefits. The massage component of oil cleansing also benefits mature skin by stimulating circulation and encouraging lymphatic drainage, which can reduce puffiness and support healthy cell function. Now let's discuss technique for effective oil cleansing. Always start with dry skin. This is crucial. Oil works best when it's not diluted with water initially. Use adequate oil. Don't skimp. You need enough to create slip so you can massage without tugging your skin. Usually 1-2 teaspoons is sufficient. Massage thoroughly for at least 60 seconds. This isn't a quick swipe. Take your time. Use gentle circular motions. Feel the oil warming and thinning as it mixes with the oils on your skin. Pay attention to makeup-heavy areas. If you wear eye makeup, spend extra time gently massaging your eyelids and lash line. Oil breaks down even waterproof mascara without harsh rubbing. For pure oil cleansing, after massaging, let the oil sit on your skin for 30 to 60 seconds to fully dissolve everything. Then place a warm, not hot, damp washcloth over your face. Let it sit for 30 seconds to steam your pores gently. Gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. Usually 2 to 3 wipes total. For emulsifying oil cleansers, after massaging, wet your hands and add water to your face, continuing to massage. Watch the oil turn milky as it emulsifies. Rinse thoroughly with lukewarm water. Make sure all cleanser is removed from your hairline, jawline, and neck. After oil cleansing, your skin should feel clean, soft, and comfortable. If it feels greasy, you didn't remove all the oil. Use your warm cloth again or add a gentle water base.
Con sửa điện thoại cho mẹ thôi anh nào.
Chịu khó xíu ha chị ha. Chị lâu rồi không lấy á.
Mẹ,
Ừ.
gắn lại con.
Để đi hồi gắn.
Mẹ.
Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHEAS, dihydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHEAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation, irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or 𝒂𝒄𝒊𝒂𝒍 evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and 𝒂𝒄𝒊𝒂𝒍 improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If 𝒂𝒄𝒊𝒂𝒍 is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, anti-androgen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils.
Dụng cụ chị làm cho hai nhẹ là riêng cho từng khách em nha. Mình ở quận mấy em hả? Long An á hả? À. Nè mình có hút thuốc lá không vậy em?
Có gì?
Có à. Da em giàu nhờ quá trời nè.
Dạ.
Em năn nỉ nó đi, nay là đúng năm thì
Vậy đó hả?
đúng năm.
Em cũng ở Long An luôn hả?
Em đi lên đi xuống.
À, lên đi xuống Sài Gòn Long An hả?
Dạ. Hồi chiều hôm qua em nói với nó là anh đặt lịch người ta rồi, anh trả tiền người ta rồi, bây giờ mày không đi anh mất tiền. Lúc đó nó mới chịu đi, nó mắc cỡ.
Mà Long An lại mở khúc nào?
Nghe Bến Lức rồi chị.
À, Bến Lức hả?
Sáng bé như đi dọc đường xong rồi thôi đi về nửa đường đi về.
Cái này để lâu nó rỗ mặt á.
Em nói là em mày để lâu là mai mốt mà nó viêm lên một cái là em nó là khó trị lắm á.
Cái này là bạn của em hay là sao?
Dạ.
Vậy em là bạn em hả?
Dạ.
À. Ừ. Cái chân nó sâu.
Anh Mẫn có đang xài iPhone không anh Mẫn? Tại vì bụng của bạn bạn xem còn mê lắm.
Thôi chị đăng lên chứ thế nào
Anh xem sao á.
ngày nào đêm nào cũng giờ hết mà đêm nào cũng giờ cũng ngủ được, nó ghiền rồi. Mà như dạo này như có người ta lấy nước siêu thị người ta đi con những kênh khác là sao?
Đúng rồi anh. Họ lấy họ bán thuốc, bán kem trộn á.
Dạ.
Nhiều lắm. Mà nhiều khi mình không quản lý được hết á.
Thấy nhiều lắm chị.
Nó nhiều quá.
Ở trên này tối còn đi cà phê chứ về dưới đó rồi tối đâu có đi đâu được đâu, thì chỉ ôm cái điện thoại coi.
Ủa với đó buồn lắm ha anh Mẫn?
Nó ngủ sớm lắm thì dân người ta ngủ sớm lắm.
Ngủ sớm dậy sớm cũng khỏe mà.
Dạ.
Anh Mẫn cũng không biết em sử dụng kem mới để làm cho nó yên tâm.
Em nó là ở trong cái môi trường mà bụi nhiều, dầu nhớt nhiều. Chị Thị một lát nữa tư vấn cho em nó nên xài cái sữa rửa mặt nào đó để cho nó
Dạ.
có bị lại nữa.
Dạ. Em có sữa rửa mặt.
Nhưng bạn sử dụng sữa mặt giống anh Mẫn hay được anh Mẫn?
Anh Mẫn có bị mụn nhiều không?
Dạ anh bị mụn nhưng mà mụn li ti rồi chị.
Ừ.
Dạ mụn đầu đen li ti.
chị. Để lâu nó lan ra.
Cho xong đi chị. Em chỉ làm luôn cho xong thôi.
Đi sát vào đây. Nãy em nói người ta nhiều quá người ta. Nghỉ. Nghỉ. Cố lên nghỉ nha.
Dạ.
Em chịu tốt à. Nó rút ngắn thời gian đi. Chị cố gắng làm kỹ nhất có thể. Dưới đây nó quá trời luôn rồi em ơi. Chịu khó chút nha.
Dạ.
Với đây em lo trẻ mai mốt bị sợ lòi á. Cục bự bự á. Với cỏ à.
Xong
thuốc chị cho thuốc về uống. Với lại những cái đèn qua đây xíu.
Thứ mấy một ngày mấy một tuần, thứ mấy một ngày một.
ngày 4 tháng 8.
4 tháng 8 là 1, 2, 3, 4
mấy dụng cụ
5 tuần luôn đó. Là bữa nay là 17 đó.
mấy dụng cụ mà chị làm là dùng riêng hết cho từng khách nha.
Dạ.
Dùng một lần mình bỏ nên em yên tâm nha. Rồi quá trời luôn nè. Chịu được không em?
Dạ được.
Chịu được. Cố gắng một xíu cho hết mụn ha. Chứ không cái mặt em nó rỗ hết. Hai chị em là ở quận mấy hả em?
Em ở Thủ Đức đó chị.
Thủ Đức à?
Dạ.
Ừ.
Chị em quay được không?
Được.
Cho...
Để lát chị gửi cho.
À dạ ok chị.
Lát chị gửi qua cho.
Cái này mà không lấy thì sức kiểu gì đâu không hết nổi.
Đúng rồi, nó nhiều quá rồi nè. Dày luôn á. Mấy cái sản phẩm bôi nó chỉ hỗ trợ thôi chứ nó không tiêu được cục mụn này đâu em ạ. Ví dụ như nó hỗ trợ gom nhân mụn này, nó hỗ trợ để làm mềm da nè, nó hỗ trợ để nhanh lành thôi. Chứ còn bôi cục mụn bự cứng vậy sao mà nó ấy được.
Bây giờ sau này là phải giữ da cho sạch đúng không chị?
Ừ. Tại cậu này hay hoạt động ngoài trời.
Đúng rồi.
Với mùa hè này nè, mùa hè thì mồ hôi. Mới có một xíu da chỗ này thôi mà nhiêu đây rồi.
Mà nó là cũng không có hay cậy hay đồ á chị.
Ừ. Có sao để nguyên vậy đúng không?
Nó cũng sợ chứ không, chứ nghĩ là nó khó chịu lắm.
Để lâu nó bị viêm lên nè. Mấy nốt này là viêm rồi nè. Nhìn cục mụn bự không à. Cố gắng lên nha.
Dạ, không sao.
Cố gắng lên. Cố gắng chị mau hết.
trước.
Này mà đi trễ cái nữa, thời gian nữa là nó bị viêm hết mặt luôn á.